Yes, hi. Hi, I'm a first-timer, my first time with FWN, and I'm telling you, this is a very impressive conference. I've been to women conferences for many, many years, and this is really something else. Today I'm going to present my global pitch. Just narrowly, I did change the title for welcoming Filipina nurses. Most of the nurses are Filipinas. So for those of you who don't know me, I am a cardiologist. I'm a practicing cardiologist in Jacksonville, Jacksonville, Florida. Okay, so the scope of the problem, Jacksonville, Florida has one of the largest Filipino communities in Southeast United States. And that's why we have Jollibee, right? The first Jollibee in Southeast United States was in Jacksonville. The Filipinos make up around 35% of the city's Asian community and about 12% of all of Duval County's immigrants. So Duval County is our county, and this is largely because we have a naval base there. Because of the recent pandemic, we have seen really a significant drop in the nurses caring for our community. And over the past few months, our health systems have recruited Filipino nurses coming from either the Middle East or our homeland to become nurses to serve our community. Next slide, please. So the purpose is helping the Filipino nurses successfully integrate into the U.S. healthcare system, promoting cultural diversity and addressing the nursing shortage. Next slide. So the assumption is that the Filipino nurses, we all love them. I mean, if you have worked in the hospitals, they're the most respected nurses and healthcare workers because they are so caring and they are so good with their job. So the Filipino nurses possess the necessary skill and qualifications for the U.S. healthcare system. Cultural and social integration is essential for long-term success and retention of the nurses by the healthcare system. So the intervention is cultural integration programs and support network to facilitate the transition of the Filipino nurses, addressing challenges related to language, cultural differences, and workplace practices, to procure mentorship and networking opportunities and emotional support. Because a lot of them come without families, they don't drive, you know, they have children, so you need to provide care for these nurses so that they can stay. Next slide. The scope is the integration of the Filipino nurses in the Baptist health system in Jacksonville, Florida, which provides around 33% of the healthcare in our community. So we have Mayo Clinic over in Jacksonville, Florida. We have University of Florida, but our healthcare system has five hospitals. So we are the biggest healthcare system in Jacksonville. If you don't know, Jacksonville City is actually the biggest city land-wise in the United States.
Wow.
So the target group or the beneficiaries are Filipino nurses, the Baptist healthcare system, because we will get excellent nurses, and the Jacksonville community. So the geographic area impacted is Jacksonville, Florida. The accountability is to the Baptist health system and the Filipino community. And the duration is approximately around 2 to 3 years, because this is where the greatest recruitment of nurses is predicted to happen. So I think they have already asked the nurses to come, and it takes around 2 years to process everything. So next slide. Next slide. Okay. So the results are framework. The expected outcomes is you want the successful integration of the Filipino nurses in the U.S. healthcare system to increase representation of the Filipino nurses in the U.S. healthcare workforce, enhance cultural diversity within Baptist Health, addressing the nurses shortage by tapping into the skill and expertise of our Filipino nurses, and to improve patient care through the provision of culturally competent and diverse healthcare services. Next slide, please. So what are the deliverables? Well, we have networking events to introduce the nurses to very prominent leaders in Jacksonville. Because we are such a large community there, we have a lot of communities that we could approach. So help in housing, real estate. Some of them need financial advisors because of their visa issues. They need legal advice, support in performing day-to-day basic needs like shopping, childcare, medical conferences geared towards Filipino nurses to learn to deal with the very tough American doctors, and to enhance their skills and knowledge of the healthcare system in the United States, and mentoring potential leaders in the nursing field. So how to deliver this? We are partnering with Baptist Health System. There's the Filipino Nurses Association in Jacksonville, the JAX Filipino United, Filipino Association of Jacksonville, and Ellen, I just heard that we have a chambers, a Filipino American chambers in Jacksonville. So the marketing plan is partnering with human resources to include the program details when the nurses are oriented into our system, and of course by word of mouth through the current nurses in the system. So the risk, of course, is lack of interest in the part of the Filipino nurses, loss of focus, financial viability. You have to reach out to Baptist Health and other Filipino organizations for fundraisers and donations, like asking medical device companies or pharmaceutical companies for grants. And monitoring the evaluation is regular. We will regularly monitor this, evaluation of the implementation of interventions, assessing the progress made towards the expected outcomes. And the feedback, of course, comes from our Filipino nurses, the Baptist Health, and the patients, and this can guide the necessary adjustments to the intervention. I think that's the last one, right? And just to let you know, I have 1 more minute, okay? Just to let you know, there is a Filipina who is a producer and the director based in LA, who actually did a documentary, and she's Emmy Award-winning director. Her name is Michelle Josu. I don't know if you've heard about her. She has a documentary that she wants to really show across the country, and it's called Nurses Unseen. So it documents the history and humanity of the unseen heroes of the COVID pandemic, which are the Filipino nurses. So if you realize that 4% of the registered nurses in the United States are made up of Filipinos, they accounted for 31% of the deaths during the COVID pandemic. It's very disproportionate. And so I think that would probably be our first project, is to go ahead and do a screening of that in Jacksonville, and hopefully get all of the Filipino nurses around and a lot of the community leaders as well, because it's going to be a phenomenal film. Some of my friends have seen it. Obviously it's not available online, and they said that it is a really, you will cry when you see this very emotional type of motion picture.
What's your ask?
So my ask is, of course, for the screening, it costs around $5,000 to $10,000, so anyone who wants to donate. And the other thing is, be kind to your nurses. I mean, they work hard, and during COVID, they were really the ones who were frontline. And of course, if you want something like this, the hope is that we can spread this to other communities, because the nursing shortage is not just happening in Jacksonville and Florida. It is happening in the whole United States. And I think that we are estimating that we are going to be short 2 million to 3 million nurses in the next coming years. Canada too, yeah. So if there's anything, if you wanna collaborate with me, we could do it in your community as well. Very good. Thank you.
Thank you.
Yay. Oh my goodness. Thank you very much.